Is there anything like a plan to replace Obamacare with?
Well, this has been the great, bait and switch. It's been a, excuse me, it looks like a fraud from the beginning. This notion that they're going to repeal and then replace because, they opposed Obamacare from the start. They've never had a plan over the last 7 years. And now it's pretty clear that they're not going to be able to come up with a plan which meets the standard that they've now set, which is it's got to be bigger and better
More
and cover
people covered with
more people and
right.
less expensive. So everyone's waiting to see what they come up with, because when you describe a way of doing that, there are really only two ways to do it, right? One is a Medicare for all type system. The other is Obamacare.
Right.
And when you describe, the elements that have to go into meeting those criteria, you end up with Obamacare. Now, look, obviously, Obamacare is not perfect. Many of us have been working to make certain improvements to reduce the costs of healthcare in the exchanges and the size of the copays. But you know what? We could do that by getting a group of bipartisan members together and do that very quickly. They're not interested in improving the Affordable Care Act. They're interested in blowing it up.
Two other quick things. One is part of the discussion about healthcare. President Trump always mentions price of pharmaceutical drugs.
Yeah, I'm glad you raised this because, there were a number of things that Trump talked about in his speech that we could move on very quickly. We mentioned modernizing our infrastructure. I've got a plan out there. Others have plans out there. Trying to make child care more affordable. Many of us have put plans on the table to do that. And then, of course, what you say, which is reducing the cost of prescription drugs. We could get it done. In fact, I joined with Bernie Sanders and others just the other day in introducing legislation that would allow for the reimportation of drugs. Let's let the market system work to reduce the costs of drugs. This would allow reimportation of drugs in Canada. These are drugs produced in the United States, sold here at very high prices. You can get them at much lower prices in Canada. And if you allow a system of reimportation, assuring quality control, which is important, then you can help reduce those costs. There are other ways, too, allowing the Medicare program, the government to negotiate drug prices. That's a no-brainer. I don't care how we do it, but we need to reduce the cost of prescription drugs. Trump talked about it, and then he met with the pharmaceutical industry, and we haven't heard a peep since then. So I'm glad you raised that. One of the biggest complaints I have about the speech is he created this impression that he's ready to move forward on all these things. That's not what he's doing. The one thing he's moving forward on is trying to blow up the Affordable Care Act, right? And his very divisive immigration policies.
Right.